I'm Denise Williams. I am the Manager of Therapeutic Services at Genesis Behavioral Health, and I have worked in the field of behavioral health and addiction for over 35 years. Addiction does not affect just one group of people. It affects all ages, all economic backgrounds, all classes, and the drugs of choice also vary too among those different ages and classes and socioeconomic backgrounds. We all know someone that has a drug or alcohol problem, and it may be a family member, it may be a friend, a coworker, a child, and it's very challenging to see someone struggling with addiction, and many times we just don't know what to do. We don't know how to help, and we can feel very powerless watching that person change their life, change their lifestyle, and start to deteriorate from being the person they could be if they weren't drinking and drugging. If you suspect a loved one is struggling with addiction, the first thing I would suggest that you do is to gain information yourself. Learn what addiction is, learn the signs and symptoms, find out what treatment facilities are available, and also it gives you information so that you're not shaming the alcoholic or addict, but you are giving them information that they can use to support their decision to go into recovery. And one of the best ways to do that is to allow the addict to see their behavior through your eyes. So let them know what signs and symptoms that you are seeing. The alcoholic or addict typically doesn't think anybody knows they have a problem. So by you sharing what you're seeing, you're breaking through that denial and letting them see their behavior, their addiction through your eyes. And then when they're ready for help, they know that you're supportive of them. They know that you know that there's a problem and that you know where they can go to get help. Let's see, the signs and symptoms of addiction usually begin with mood swings. You would see the person experiencing mood swings. And all of the addictive drugs cause mood swings. And so when a person is craving the drink or drug, you'll see one mood, and then when they're coming down off the drug, you may see another change in mood. When they're actively using, you're going to see them being under the influence, and that's going to affect the way they behave. So mood swings are probably one of the first indicators, and also mood swings that don't match what's going on around the person's life. Some other signs can be secrecy, things that they used to be very open about. Now they're not telling you where they're going or what they're doing, or there's money coming up missing, or they're not telling you who they're hanging out with. So there's just some things that are secret that didn't used to be secret with this person, and they're not being open and honest about what's happening. Some other signs and symptoms might be physical health. They may start to look different. They're just not taking care of themselves. They're not taking care of their personal hygiene. They're not taking care of their teeth and their medical care. Typically when people are struggling with addiction, they don't take care of themselves because the focus is on the drink or the drug. So those are some of the real common symptoms that people see. And many times people see these symptoms, but they don't want to believe it. They don't want to believe that they're dealing with addiction. So they come up with a lot of other ideas about or explanations for why the person is doing what they're doing. And many times it gets blamed on stress. It's like, oh, they're stressed with their job, or it's a bad relationship, or this relationship is breaking up and that's why they're acting that way. And that may be a good excuse. It might be actually occurring. Sometimes it's hard to know which came first. Was it the addiction and then the stressful events, or the stressful events and then the addiction? People that are struggling with addiction have a lot of shame and guilt, and they don't want to believe that their drinking and drugging is causing the consequences, causing the family disruption and financial issues and relationship issues that the addiction is causing. But we forget, or sometimes just aren't aware, that addiction is a disease very comparable to diabetes or high blood pressure or cardiac disease. Both of those all of those diseases have environmental factors, they have hereditary factors, and they have lifestyle factors that impact them. And we don't think about addiction as a disease. Many times we assign it to a moral issue, or the person's bad, or there's they just need to quit, they just need to stop. And we don't do that with heart disease or diabetes. We don't say, well, you can just stop or you can just quit. Those diseases, a person has them forever. It's just a matter of managing them and learning how to manage the symptoms so that they don't cause further destruction to the person or to the family. So that guilt can prevent them from seeking treatment and getting help because they don't want anyone to be putting them down or to pointing out all of the things that they've done wrong and as a result of their addiction. And what we try to do is help the patient work through the guilt and the denial and to really look at life as it has been with their drug and alcohol use, but also to look at what it could be without the drug and alcohol use. And so help them to work through the forgiveness, and that helps get through the denial. It helps them to realize that it is okay to have this problem and it is okay to seek help and that help is available. I think, that recovery is possible. People do get sober and stay sober. I see people on the street that I've had as clients, and they'll come to me and say, hey, I've been sober 5, 10, 15 years. And that's very rewarding to see that people have recovered. And there are people in recovery that you just don't know they're in recovery because they don't talk about it. But because once a person's been clean and sober, they start to blend in with life. They're working, they're raising their children, they're doing what everybody else is doing. And you don't know that they're in recovery unless they happen to share that with you. So they don't look like alcoholics or addicts once they've been clean and sober for a while. But recovery is possible. It does happen. And I think it's just a struggle, and it's just keep at it, keep trying. And if you keep trying, you will be successful.